Blood, wow, one of the most important elements in our bodies. Without healthy blood, what does that mean? That we are unhealthy. Having a pioneer in the field of blood understanding and immunology is our next speaker. So without any further ado, it is my honor and pleasure to introduce award-winning, high achiever of hundreds of thousands of research projects at Harvard University, Dr. Dobry Kiprov. He pioneered the field of therapeutic apheresis.
It's a pleasure to be here. Thank you for inviting me. I'm all for stem cells, and I really appreciated the talk that you just heard. Some of my talk will reference what was just said, and you will get an idea of what we can do now. We heard about a variety of therapies and molecules that are in development, but it will take 10, 15, maybe more years. I'm sure that some of them will pan out, but as I'll show you in a second, we're in a crisis mode as we speak. I would like to acknowledge the Young Blood Institute as a nonprofit organization funding our research. In the next 20 minutes or so, I will try to explain to you our approach to the clinical intervention for aging. And again, you're going to hear some of the same things that were said in the previous talk. I will take you on a little different pathway, hopefully to make it more understandable for you what we really do. It is not just you as individuals, including myself, that are looking to get younger in a way, be healthier, and live a longer life. But in not many years from now, there will be 2 billion people over 60 years old. And that's all good. The problem is that 82% of these people will be sick. So as you heard in the previous talk, all these diseases are attributed to failure of sort of the immune system. And therefore, we talk about immunosenescence, which basically means aging of the immune system. I'm going to go over the immune system in a very simple way. It's an extremely complicated system, but in order to understand what we're trying to do, I will show you some stuff on a cellular level. The most prominent of these cells are the lymphocytes. The lymphocytes are divided in 2 major groups, B cells and T cells. The T cells are subdivided into CD4 cells, or helper cells, and CD8 cells, or suppressor cells. This is very important because they regulate how the immune system works. So in normal circumstances, the CD4 cells, the helper cells, help induce the immune system, and they send a signal to the actual soldiers of the immune system, which are the B cells. So the B cells have their own bullets, and they shoot them to viruses, cancer, bacteria, and so forth. Everything that the immune system recognizes as foreign. So the bullets of the B cells are called antibodies. When the invader, being a virus or whatever it is killed, it's time for the immune system to stop working. And this is the responsibility of the CD8 cells, who send a signal to downregulate the immune system. So if this happens, the immune system goes back to normal. So the soldiers go back to their barracks and wait for the next time they'll get a signal to fight. So this is an antibody attacking a virus. And as you can see here, it is a dramatic response. It destroys the virus very fast. So I'll take you through the inflammatory process that you already heard, which is that. Inflammation is one of the immune responses that happens all the time. And I believe that all of you here in this room, at one point or another, have had a cold or the flu. And I'll take you graphically through this process. As you know, the first day you start feeling very uncomfortable, but things get worse the second day, and at the third day, things are really bad. You have fever, your head is blowing, things are not looking good. So this lasts about a couple of days, and side effects. And then our friend, the CD8 suppressor cell, comes in and says, stop it. We killed the virus, go home, we're done. And slowly over the next few days, you get better and better and better, and at day 7, you're ready back to go to work. Although you don't want to, you're ready. So in aging, the situation is a little bit different, and actually a lot different. So what happens is this red line that you see on the graph. So we have the same acute immune response, the inflammation, but then, as you can see, there is a slope that is very different than the original slope. And the reason for that is that our old friend is really old. So the CD8 cell got old, or something happened to it, and it's not doing its job very well. It's doing it, but not quite well. So we have remaining inflammation that continues to bother our body. And you'll say, well, but I recovered from the flu, I'm fine, I'll go back to work. But this thing is still going on in your body. So it may not necessarily affect the original organ where the acute inflammation happened. And as you can see here, people who have had respiratory tract infection, the flu as we were describing it, or urinary tract infection, are 2 to 3 times more likely to suffer a heart attack or stroke. So all these things are connected with each other and are the consequence of chronic inflammation. Chronic inflammation causes all these chronic diseases that you showed on the previous, during the previous talk, and I showed you earlier here. So these are some of the substances, the bad substances that Dr. Maharaj is talking about, and I'm not going to read them to you, but we're going to call them pro-inflammatory substances because we know that they're associated with inflammation. And also, as you can see, there is a T-cell abnormality that kind of contributes to this whole process of inflammation. It is very likely, although we don't know for sure, that the problem starts with the T-cells. So if you look at the profile of chronic inflammation and elderly people, you will see that it is exactly the same. We have the same pro-inflammatory substances present in the blood of these people, and the T cells are faltering as well. So this causes a chronic disease, which is much more common in the elderly. 82% of people over 65 suffer from chronic inflammatory diseases. 7 of 10 deaths in the United States are due to a chronic inflammatory disease. Very few people, any place in the world, die of old age. People die of diseases, and these diseases are the most common killers. Now, there is another abnormality. The immune system sometimes falters, and that is called autoimmunity. Now, the healthy immune system is designed to recognize self-tissues and never attack them. It recognizes foreign invaders and attacks them, but it never attacks its own body. Now, in autoimmunity, this law is broken, and the same severe response that you saw from attacks from antibodies to viruses can happen in different organs and attack them and destroy them literally. So these are some of the diseases that you probably have heard of, and these are autoimmune diseases. They are characterized by the presence of autoantibodies. These are antibodies that attack self-tissues. In some cases, they're specific to certain organs. In different diseases, they may be specific to certain organs. But in most autoimmune diseases, there are a few antibodies that occur almost in all of them. And one of them is called ANA, anti-nuclear antibody, which attacks the nuclei of the cells. Another common antibody is cardiolipin. Cardiolipin contributes to enhanced clotting, and this can cause severe problems, as I will show in a second. But these antibodies are present in the majority of patients with autoimmune diseases. Another thing that is very interesting, and I think this was mentioned earlier in the previous talk, is that helper CD4 cells are too many in these diseases. So they promote inflammation, they promote immune response. At the same time, the CD8 cells that downregulate the immune system are low. As a consequence of that, we have a CD4 to CD8 helper to suppressor ratio that is very high in these diseases as compared to normal. Now, it's interesting that these same autoantibodies, ANA and anticardiolipin antibodies, are present in older people. People over 65 have many of those antibodies. They also have an elevated CD4 to CD8 ratio, exactly as in autoimmune diseases. So here we have, again, a comparison between autoimmune diseases and older people phenotype, and you can see it is exactly the same. So why am I drawing these comparisons and why I'm telling you all this? I'm telling you all this because we know how to treat some of the autoimmune diseases. It's been a long time since we started treating them, and we have learned how to treat them. One approach is to remove these offensive antibodies as well as the pro-inflammatory factors. Now, of interest is that two of these parameters, fibrinogen and the anticardiolipin antibodies, enhance blood clotting, as I said. And this can cause heart attacks and strokes, which are much more common in older people. So we have been using something called therapeutic apheresis to remove pro-inflammatory factors and autoantibodies in autoimmune diseases since the 80s. Clinical trials, both controlled and uncontrolled, have proven that therapeutic apheresis is very efficacious in the treatment of over 50 autoimmune diseases. So you'll ask, what is it? Apheresis is a Greek word and means to take away. The ancient Greeks believed that bad substances in the blood can cause disease. They called them bad humors. They tried to take them away, and basically they used, at that time, bloodletting. Didn't do anybody any good, but they had an idea. Now, 3,000 years later, we call these bad substances autoantibodies and pro-inflammatory factors. And we have the technology to remove them more efficiently. And this process of removal is called therapeutic plasma exchange or plasmapheresis. So I'll show you a short movie just to see the process.
Therapeutic apheresis refers to a specialized medical procedure in which blood separation technology is used to remove abnormal plasma constituents or blood cells. Whole blood is removed from the patient into a blood cell separator, which utilizes centrifugal forces to separate whole blood into its individual components: plasma, platelets, white blood cells, and red blood cells. Plasma, or a specific blood cell type, can be removed and replaced with physiologic fluids or cells to treat relatively uncommon, but usually life-threatening diseases.
So this procedure removes the abnormal substances, the autoantibodies, and the pro-inflammatory factors very efficiently. As you can see here, the blue is where we start, and the yellow is where we end, and this is true for fibrinogen as well as for all the autoantibodies that we want to remove. From one plasma exchange of one plasma volume, we can remove 60 to 65%. If we force it a little longer, we can remove 70, 75%. That's very efficient. Interestingly enough, we can also turn around the CD4 to CD8 ratio. As I showed you, this is increased in autoimmunity as well as in aging, and we can turn it around and it becomes back normal. Now, let me give you a couple of examples of what we have accomplished after starting to use therapeutic apheresis in the treatment of autoimmune diseases. There is a killer disease that is called Thrombotic Thrombocytopenic Purpura, or TTP. Before we started using apheresis in the early 80s, this disease had a mortality rate of 95%. After we started using plasma exchange for the treatment of this disease without any other drugs intervening, the mortality rate today is 12%. There are very few other things in medicine that compare to that, maybe penicillin. Another disease that we treat is called Myasthenia Gravis. It's a neurologic disease that affects the muscles and primarily affects the muscles of the face. These people have something called ptosis, so they cannot open their eyelids. On the left-hand side here, you can see a patient before plasma exchange, and this picture on the right-hand side was taken during the procedure. It's an immediate response. It's very rare to see with medications. And a little bit closer to what we're discussing today, one controlled and one uncontrolled study from Europe has shown that plasma exchange can stop the progression of Alzheimer's disease, a disease that is unique for older people. So we see that plasmapheresis can improve all these parameters, and we also saw that all these parameters are the same as in old age. So by all means, we can go and start doing plasma exchange in older people. But in medical science, we need an experiment. We need an experiment, we need analysis of the results of this experiment, and then forming a hypothesis. And this experiment, as you heard earlier, came in the form of heterochronic parabiosis. I'll bring you back to the Greek language. And hetero means different, and chronos is time. And parabiosis describes an experimental model where the circulation of two animals is put together. So the ultimate experiment that was done to confirm that what I was talking about is probably applying to aging was done by Irina and Michael Conboy with their team at the time. This was 10 years ago. So here a very short movie just to show you what parabiosis looks like. So we have two mice. One is an older mouse, the other one is a younger mouse. Their circulations are connected, and substances from one mouse go to the other. So there is a mixture of the blood, and this mixture creates a 50% blood of each mouse. So we have good substances going from the young mouse to the blood to the older mouse and vice versa. And here's the ultimate experiment that actually involves stem cells. And as I told you, I'm a big fan of stem cells. So here you can see that blood was taken from two connected mice, isochronic, and it was taken also in a different experiment from the heterochronic mice. So stem cells of the old mice were placed in a Petri dish with the plasma of the isochronic mice. So the old plasma with the old cells. And as you can see, at 5,000, it is growing, but not very well. However, if the same cells, the old cells, are placed in another Petri dish with the plasma taken from the heterochronic experiments, they grow 4 times more. This is a very important experiment. So further experiments performed by different people, which is nice because it was able to be reproduced, show that there are structural as well as functional changes all over the organs of these mice. So the lymphocytes, the immunocompetent cells, as well as stem cells, they live in the plasma. And these authors said that the environment where these cells live is very important for their senescence or not senescence. By now, the Olympic star today, you probably know who Michael Phelps is. So Michael Phelps holds 7 world records and is the fastest swimmer on Earth. He swims in Olympic pools. They're kept artificially at 71 or 77 to 81 degrees. Now, if you put Michael Phelps into a pool where the temperature is 100 degrees, he will be slower than you and I. And that's very important to remember. The environment is critical for the behavior of cells and humans, for that matter. So we know from these experiments that declining good factors in the blood are present in older people and older mice. And there is accumulation of inhibitory factors, which we already discussed. Now, we do know the inhibitory factors. Maybe not all, but we know quite a few of them. On the other hand, we have no clue about the other factors. GDF, as you heard before, was experimental, but it didn't pan out. So based on all this, I created the hypothesis that plasmapheresis can be used for the treatment of age-related disorders and for preventing the damage that the aging process causes. So here's how it works. There is a patient or a candidate, and there is a machine, and we take the plasma out. We know very well how to do that. The question would be, what do we put back? And we really don't know the good stuff that is in plasma. So when all this came about, I got a lot of phone calls, and people came to me, very smart people, and they said, why don't we go to Utah and get 5 young, strong guys, take their plasma and infuse it in me? Well, it's not that easy to do for a variety of reasons, but it basically shows that a lot of people just don't have the experience that we have. I've been infusing plasma for 30 years, and at my age, I can tell you for sure that it takes 30 years to get 30 years of experience. The first thing that comes to mind is you are not mice. The human body is the most complicated organism on Earth. Cannot compare to mouse, cannot compare to rabbit or anything else. It's human, and you're all individuals. When we do animal experiments, all the animals are exactly the same. We make them the same. We cannot make you the same. You're all different. So one option is obviously to give plasma back, taken from younger people, and that's an option. However, it's very complicated because it's a blood banking product. It gets regulations and so forth. But I'm not that concerned. We can overcome that. The problem is that if you give plasma, and I've been giving plasma to people for 30 years, as you heard, we see a lot of side effects. And some of these side effects are really bad. You can see anaphylactic shock. You can see all kinds of bad things, even death. The last thing you and I want to do to someone who wants to live longer and healthier, to expose them to 57% risk of a severe side effect. So in my opinion, this is not a choice. So I have developed a fluid which is very different. For a variety of reasons, I'm going to call it Dobri's fluid at this moment. So it is heterochronic compared to plasma. The risk transmission of plasma itself is small, but it's not zero. In my fluid, it is zero. Plasma is very difficult to obtain. You need quantities, you need to match it, and so forth. And again, we talk about the reactions, 57% reactions with plasma, and 3% in my fluid. The other thing is that plasma is a modest antioxidant, and my fluid is a potent antioxidant. So I was going to talk to you about antioxidants, but because of time limitations, I'm going to skip a few slides. And I'm going to go to the end here. Basically, antioxidants are very important, but we don't have time to discuss them. The main point here is that we can serve as the most potent antioxidant in the body. let me tell you where we stand now. We have an IRB clinical trial approved that is going on now, and it is based on very strong science and evidence. We have the team, the tools, and the talent. We firmly believe that our results will be positive, and by the end of next year, we hope to have several clinics in the United States as well as in Europe open. And since we talked about the Greeks a lot, I'm going to leave you with this. It's another Greek who 1,500 years ago tweeted this statement. I'm going to let you read it, and I'll leave you with the note: carefully choose your physician. Thank you. Thank you.